This year when I was hunting, actually my knee locked up when I was like 4 miles back in the wilderness, and it was a little scary. I literally couldn't walk for probably an hour. Luckily I was able to manipulate my knee, get it moving again, and I got back to the car, but it was scary. So when I was a senior in high school, I was playing football, which I should not have been doing. I weighed 135 pounds, did not belong on the football field. Somebody hit me from the side, I didn't see it coming, and my knee, it felt like it buckled, but what happened was I tore meniscus in my knee, and I also had a partial tear of the ACL. About 10 years later, I re-tore that while I was skiing, and I got along okay for a while. Well, I got into triathlons, and on one of my trail runs, I just stepped wrong, and I actually tore more of the meniscus, and I also broke a piece of the cartilage with part of the bone on that inside my knee. So after that last surgery, I tried to keep doing triathlons. It just hurt every time I ran. I was able to keep biking, which is kind of the thing that I love the most about doing that. I love biking in the mountains. I love, road biking. I like any kind of biking. So I was getting along fine until about 2 years ago, and I noticed I was having swelling after biking. And then last year, during the mountain bike season, I literally stopped because I just couldn't do it. It hurt while I was trying to go uphill, and coming downhill is just supposed to be fun. And it wasn't fun, it was just painful. It really hurt. So I finally decided, I'd been recommended by surgeons for 3 years now to have a total knee replacement. And I'm looking forward to getting back to life. For me, it wasn't an easy decision, but I'm confident in the decision I made because I know that with the current surgical techniques that they have and with the level of rehab that we can do, I'm going to be back to doing the things that I love to do. So as a physical therapist, you probably wonder, and I obviously asked myself, why can't I just do this myself? Why do I need to pay a physical therapist, or why do I need their expertise? The truth is, there are things that they can and will do that I will not and cannot do to myself. I'm just so impressed how, they didn't treat me they treated me like a patient. They did challenge me to do whatever it took. So there was times where I'm like, I don't want to do this today. And then, they're really good about, hey, do you remember that? And it's on our wall. It says whatever it takes, and they just point at it and say, hey, you know what, we can do it now, or it's gonna be harder tomorrow if you wait till tomorrow. So, the truth is it's not as bad as you think it's gonna be, but they were awesome about, kind of pushing me when I needed pushed, and also backing off and helping me deal with pain when I needed that. Honestly, I still have pain. I'm only 8 weeks out of surgery. I am on the bike, I'll tell you that. I get on the bike, I'm only 10 minutes a day, but it doesn't hurt. I'm excited to where I'm at and where I'm going. When I walk now, there's times where my knee feels good. It doesn't have that pain that I had before. So I'm excited about that, and I don't have any doubt that I will be back to doing what I want to do.